Alright, so today let's talk about enlarged heart. Why people's heart can get big in their chest, and how do you know? So how do you know that the person developing enlarged heart? Alright, so let's define enlarged heart. What is enlarged heart? So enlarged heart is when the heart is larger than its normal size. So do we have a fixed normal size of the heart? The heart does not have a fixed size. So research already says that when you make a fist is like a blow. Your blow is about your heart size. So which can range about like maybe 12 cm long and 8 cm wide. Then the thickness of the muscle about 6 cm, but it's not fixed. It varies with individuals. But once you fix your fist like this, your blow like this, it's about your heart size. Your heart could be larger than this a little bit, but that's an approximate measure. So if your heart is bigger than the normal expected size, then you have enlarged heart. So let's get to the symptoms of enlarged heart. So one of the symptoms is difficulty breathing or shortness of breath. So it will be like you try to take in breath and you suffer, you catching harder to catch your breath. Enlarged heart can cause it to happen. And the other thing that can happen is chest pain can be there. The chest can be paining you, compression in the chest. So the next one can be fatigue, or you feel weak, tired. So extreme weakness, enlarged heart can cause it. So when you see people having weakness, sometimes breathing faster, don't see it like asthma. Now every fast breathing can be asthma. No. People with difficulty breathing that is repeated without, asthma breathing is different. The person's shoulder can be still like they be breathing. But someone who is just muscle free and they are breathing like that with distress, sometimes pain in the chest, most commonly is heart enlargement that can cause it. So let's get to another symptom, feet swelling. The feet can be getting swelling because the heart is not pumping well to proper circulation. So feet swelling can be a symptom of heart enlargement. Another thing can be dizziness. You're feeling dizzy always. Even after resting, you come out, you're still feeling dizzy. So heart enlargement is something that is bad. So there are a lot of risk factors that are responsible or that can cause heart enlargement, enlarged heart. So let's talk about a few risk factors of enlarged heart. The first one is high blood pressure. People that suffer high blood pressure, how does it happen? So high blood pressure will cause the heart to function more than the way it's supposed to function. So the heart will pump blood harder than it's supposed to pump blood. So what will happen now is the muscles of the heart will suffer heavy tension. Now it will start getting stiff and very hard. So once the muscles of the heart start getting stiff, it affects the contraction. Then the supply of oxygenated blood to the heart muscles and nutrients will be a restriction because contraction is not going to be perfect because the muscle is getting stiff because the muscle over contracted as a result of the high pressure. So what the heart muscle is supposed to receive for its own nourishment will not be received. So this can cause the heart muscle to be stiff and start getting enlarged. That's one factor. So the next one is coronary heart disease. Alright, let's discuss this one. Coronary artery is the artery that supplies the blood to the muscles of the heart. So any problem with that artery, especially when the artery is narrow, what we call arteriosclerosis. Once the artery is narrow, blood supply to the heart will be a problem. Or when the coronary artery is blocked, blood supply to the heart muscles will be a problem. So this will cause the heart muscles to also be stiff and start getting enlarged. The other risk factor is high cholesterol. So cholesterol are fats. So cholesterol at high quantity, especially when you have more than 200 milligrams per deciliter and going higher, high cholesterol can cause what we call the deposition of plaque in your arteries lining. So certain hard substances will be placed in your arteries, making the arteries narrow for blood not to be able to pass freely. So if blood cannot be passed through the arteries for the heart muscles to receive blood supply at sufficient quantity, what can happen is that the heart muscles suffer a lot of tension. Right? So the heart muscles cannot contract properly. So high cholesterol level will cause narrow arteries, arteriosclerosis. The next one is obesity. So obesity is overweight. People that are very big, overweight, you are bigger than your size, very fat and big people overweight. They are at risk of high blood pressure, they are at risk of diabetes. So they can also experience heart enlargement. So we have excessive consumption of alcohol, high alcohol intake. The people that can drink alcohol too much. So let's discuss how alcohol can cause heart enlargement. So alcohol can damage the cells of the heart. So how does it happen? There's a word called oxidative stress and mitochondrial dysfunction. So when we talk about oxidative stress, it involves the heart cells comprised of DNA and it comprises of protein, it comprises of lipids. So the DNA can be destroyed, protein can be destroyed, lipid can be destroyed. So the cell component comprises of those organelles. So once those things are destroyed, the cells is affected. That means the heart muscle is going to be affected. Then you start having abnormal heart enlargement, even damage of the heart muscles. That's one thing. Then mitochondrial dysfunction. So the mitochondrial portion of the cell, mitochondria is an organelle, one of the cell's components as well. It's considered as the powerhouse of the cell that is responsible to give the cells energy. So that cells will not be functioning because of the intake of alcohol. So the cells is not functioning, that we call it mitochondrial dysfunction. So once that cell is not functioning, it causes the heart muscles not to function well and be exposed to enlargement because the cells is not flexible, so they are stiff and they start getting enlarged. So excessive alcohol can damage the heart muscle cells. I hear many people say, oh, alcohol is good for the heart, it's good for the heart. People make excuses so as to grant their habit, but alcohol is destructive to your heart muscles. Please be careful. So the next one is diabetes. Very high blood sugar beyond measure. So diabetes can cause heart enlargement. How does it happen? It causes metabolic disorder, especially insulin resistance. Most especially now, it has to do with type 2 diabetes. So this process can cause heart enlargement because once metabolic disorder is happening, it will not allow the heart muscles to freely function. So you have high protein toxicity and lipids. So even though yes, the body needs protein and lipids, but not at high level, like we say high cholesterol. So diabetes, people that are diabetic are exposed to having high cholesterol too. So there's a same, so the whole trend is just a cycle. It's just a cycle. High lipids is associated, or it can happen with people who having high sugar level, who are diabetic. So you see that increased proteins, increased lipids, they can affect the heart muscles, damage it, or make it not to function properly and start developing stiffness and get enlarged. So let's get the last one, smoking, most especially tobacco. So in most of my videos, I talk about smoking, I talk about diabetes, those lifestyle conditions that affect your health. So smoking is one thing again that we're going to talk about. Smoking can cause rapid heartbeat. And like we said, people with heart pressure is because of the rapid heartbeat. Heart beating too fast can get the heart muscle weaker soon. So the smoke can also lead to the arteries, muscles, weakness, and even damage. So once the muscles are damaged, they cannot contract properly. They will be stiff. And this can also lead to arteriosclerosis, narrow of the arteries, because the arteries are supposed to contract so that blood can flow. But because of the reduced contraction, it's resisting blood flow. So the arteries become narrow. So this is what causes heart conditions like enlarged heart and sometimes heart failure. So to prevent heart failure, all of these things that we just listed, let's be careful. Do not smoke. If you are diabetic, make sure you observe your diet. We did a video on diabetes. Just check out this video. It has to do with diabetes. And we did more videos that involve lifestyle changes and whatever, best foods for kidney, this and that. try and follow this page. We are giving you more details on health. So please follow us for more health talks. To prevent this condition, make sure when you have pressure, you observe your blood pressure by a BP cuff. The guy at Lucky Pharmacy, the guy Bounty Pharmacy, Abia Pharmacy, even Redemption, try and get one. Also get the sugar machine. Get it straight and the machine itself. Testing yourself every time is very important so that you realize any early symptom of diabetes from the measure or from the pressure. So try and get these things at home. You can learn how to use them yourself to prevent you from entering this state. If you have any family history of enlarged heart, please start doing your exercises now, because you can likely experience that because it's what genetic. So once your makeup is from a family background, that thing that made a person to experience heart failure can possibly make you to experience heart failure. But one way you can control is a proper lifestyle. Avoid alcohol, avoid smoking, do regular exercises, reduce your fatty food intake. This will help you have a regular body weight, maintain body weight, rehydrate properly. So thank you so much. This is Dennis. Keep following us for more health talks.